Hi, welcome back to our Sisterhood in Surgery webcast. Today's show is very relevant to many of our viewers, negotiating your physician contract. And of course, I have my co-host Palma Shaw here today with me and two wonderful guests. Welcome. I'll start with introductions. Remember, this is a live webcast, so if you have any questions, join by web, go to pollev.com, enter DeBakey, send me the question, or by text DeBakey to 37607, and we'll get your questions answered by our experts. So our first guest is Dr. Shlomit Shaw, who just joined us recently. She is the new Houston Methodist Executive Vice President, Chief Physician Executive of the Physician Organization, President and CEO. So welcome. We talked before this. She is a great addition, a female powerhouse. She's has multiple degrees, MD, PhD, MHCM. Prior to joining here with us, she served as professor and chair of the Department of Ophthalmology and Visual Sciences at UMass Memorial Health. She's also served as the president of UMass Memorial Medical Group, one of the largest medical groups on the East Coast, and a senior associate dean for health strategies at UMass Chan Medical School. As a world-renowned clinical scientist who specializes in vitreoretinal disease and surgery, Dr. Shaw has published over 200 peer-reviewed and invited papers, book chapters, and journal articles. Her clinical and scientific contributions to the field of ophthalmology have been recognized through numerous awards for academic excellence, to include the American Academy of Ophthalmology Achievement Award, the American Society of Retina Specialists Senior Honor Award, and the American Medical Association Inspirational Physician Award, to name only a few. She's also known nationally for her leadership in ensuring safe and high-quality clinical care, alongside with educating and developing the next generation of clinicians, scientists, and healthcare leaders. She is a faculty member at Harvard Chan School of Public Health, and she still plays an active teaching role in executive development and healthcare management programs. Welcome.
Thank you. Happy to be here.
Yes.
And it's my pleasure and honor to introduce Trey Hendershot, who's a health and business lawyer and is the managing shareholder of Hendershot Coward Simon Trey Hendershot III, looks out for the best interests of clients by utilizing many years of experience practicing health law, business litigation, and regulatory compliance. With more than 3 decades of experience, he's counseled thousands of physicians, executives, and entrepreneurs through contract reviews, career transitions, medical practice setups, business formations, the Texas Medical Board, and other licensing investigations, anti-kickback statute and OIG investigations, fraud and abuse investigations, Stark law compliance, litigation, and mergers and acquisitions. That's a lot of things, Trey.
Well,
I'm tired just saying them all.
Well, thank you for that. It's a privilege and honor to be here.
So before we start, I have to tell my daughter Ella hi, because she reminded me the other day that I did not say hi in the last show. So hi, Ella. Mommy says hi. Quickly, well, just to start really, like, how do you know your worth to even start negotiating a contract from an executive standpoint and from someone who, you know, sees these contracts all the time? Like, what should you consider in your portfolio that would be important to an organization?
I think it's a philosophical question.
Yes.
What is your worth? It's to me personally, it's a personal question, because I was not born in this country, and I made my trip here only to do a fellowship, and I never planned to stay in the United States. But it so happened, the land of opportunities, got some awards, and then offered my first opportunity to stay. And I was much younger then, and I remember not negotiating at all and saying, I'm going to take it with a lot of enthusiasm, just because I had an opportunity to be an American university professor, which was kind of a dream come true to me. So when you're asking this question, what is your worth, I would just say, what it is that you want to be. What is your dream job? And then the other question is pay. How much do you want to get paid? And then where is the balance? So I gave you the example of my first job because it's an example of no matter what they paid me, and they didn't pay a lot at all, at all, but I was happy to get that job for the opportunity to become an American professor.
Right. And here you are.
And here you are. Here I am today, you know, much wiser, know a lot more. But I am not sorry for that first decision. So, you know, people that are now the age that I used to be, which is in my 30s after a fellowship program, and they get the first job opportunity, you ask a really good question, what is your worth? I think people in that position always kind of underestimate their worth. But it doesn't mean that that first job and that first salary is going to settle you in that path. You can always negotiate for a better salary, you can always negotiate for a better job, and you can move. So I would just say from my personal experience, the question of how much you're worth is not about money. It's about, wow, I'm getting this opportunity. So that's personal to me, but I'm sure that the lawyer will have another opinion.
Well, I actually agree with a lot of what you've said, and that's a question that I frequently get asked when we are reviewing employment agreements. You know, most of them do come down to the dollars, but I always tell clients to look into what are your personal goals? Where do you want to be? What do you want to accomplish out of this position? And from there, we can start structuring what is your worth. It may be money driven. It may be an ability to have, if they're going in with a private group, an ability to have a partnership interest. It may be that if you're on faculty, the abilities to do research. And so, first of all, we always look to what the individual goals are. And then, as I say, it comes down to money. And so there are, from my side of the desk, there's many surveys out there, and I've reviewed multiple employment agreements, so I have a pretty good pulse on what the going rates are for various specialties. And so we can look into, like MGMA, they have a survey that talks about what compensation should be and gives percentile ranges. And so we can look at that and use that as a standard to help develop what is your worth.
So another question, I don't know, Palma, if you had one, but can you explain, what MGMA is? Some of our viewers are still training. MGMA, like how does that, why should that be important to them?
So MGMA is a benchmark. There's a bunch of other benchmarks out there. For example, in ophthalmology, I'm an ophthalmologist, I'm a retina surgeon. There's an AUPO benchmark, which is American University Professors of Ophthalmology. It's a different benchmark. There are a bunch of them, but most medical group, and we are a physician organization, which is really a medical group, use MGMA because this is the Medical Group Management Association, and they do benchmarks of physician medical groups. Every time you have a benchmark, I'm a scientist, and so you always want to compare apples to apples, and there is not an ideal benchmark. The benchmark is really done out of surveys of salaries. If you want to participate in MGMA, you have to contribute and say, okay, well, how do you pay your physicians? And all of these medical groups across the countries, they say, okay, here is what we pay a vascular surgeon. Here is what we pay our neurologists. Here is what we pay our pediatricians. However, we know that there are different situations. Now I'm in Houston Methodist. It's a completely different environment than the environment that I was only 7 months ago in Massachusetts. The institution is different and the salaries are different. So when you take MGMA benchmark, you can slice and dice it, but the main thing is this: you have to have a benchmark to be fair. So from my point of view, I'm signing on every single hire that we get. Everyone that joins Houston Methodist, all their contracts have my signature on it. And so how will I know if it's fair? The way we go by paying by the base salary by that benchmark, so we know at least the base is fair. Otherwise, you can get into really serious troubles of pay inequity.
Okay. And does it matter what state you're, because I mean, Houston is, but just population-wise and vascular disease-wise, for example, in our specialty, is a lot different than, say, if you were in a small town in Idaho, so.
Yes.
Yeah.
So you can slice and dice it by areas. You can say, okay, well, what do they pay in the Northeast for that? Mm-hmm. What is the median pay for a vascular surgeon in the Houston area or Texas area or Midwest area or California? You can do that. There are a lot of differences in salaries. I actually have a slide show for you a little bit to show you very interesting things, because I know that a lot of your viewers are female surgeons, hopefully. And I just wanted to show you, I don't know if we can go through this really, really quickly, just to show you, it's not going to take a long time, just to show you the differences in the, I'm good. So here we go. So this is really the gap between a gender gap between male and female, and this is published by the AAMC in 2021, this most recent one. And what you can see that over the past years there has been a consistent pay gap. Okay, the top line here, top graph, is paid for male physician, and the bottom line there is females. And even though salaries have increased for both, the gap still remains. So this is something to keep in mind. Okay, so we're not talking even about areas in the country, we're just talking about gender. And here is the physician gender pay by specialty. And if you look at the bottom left in this slide, this is my own specialty, ophthalmology, which you can see that the dark green line is the average male salary, and the bright green is a female, and there is a pay gap in that specialty. So there are specialties that there are more pay gaps noticed all over the country, and there are specialties that is less. And if we sliced it by area, we would see, for example, when I came to the United States first, I was in the state of Kentucky. This is one of the states that is known for the huge pay gaps between Kentucky, for example. There are others as well. And so, and it's not really an American thing. This is an article that shows that this is an international thing. So just by being female, you're going to be paid less, even though you're a physician. And we know that this exists for females all across the world for all occupations. But it's a little bit jarring that it even exists for the same specialty in medicine. I think it's a little bit jarring to see that data. That's why I brought it today. And this is an article that I would like to recommend that everybody reads. It was published earlier this year, 2023, in the New England Journal of Medicine, really addressing why there is understanding why there might be a gender pay gap still today. And the authors are talking about, perhaps because all our salary models, a lot of our salary models are based on RVUs and production. Perhaps female physicians, this is what the author says, perhaps they spend a little bit more time with their patients. Perhaps patients feel a little bit more comfortable revealing more problems and asking more questions, and you're there, you need to produce, but you're answering the questions because the patient keeps asking. And perhaps they ask male physicians less. So it's a fascinating article that I really wanted to share with you. And we can take the PowerPoint off and we can go back to the questions. But I just wanted to make that point that although we have benchmark and although we try to be fair, the gender pay gap exists in this country, in this state, in this country, in the world.
Well, that is something that I would agree with, because I do see that in many of the contracts that come across my desk. And after having done this for 36 years, I've watched over time, and it does appear from what I'm seeing that gap is closing to some degree, but there is still a significant gap there. And that's one of the things that, for example, the surveys like MGMA come in to be very helpful, because you can utilize that to go back and try to negotiate to bring it in to where that gap is reduced many times.
But I would bring up the fact that we did last December a show called with Verify, the company that's currently running a survey for vascular surgery for the Society for Vascular Surgery, basically trying to find a better way to value vascular surgeons, to really redefine our value. Just like Dr. Schall said, I spend a lot of time with my patients. Am I slow? No, I'm thorough. I'm detailed. I get great reviews from all my patients. So am I churning out 40 patients, or am I churning out 25 really happy patients? Am I making better diagnoses? I mean, how are we judging the metrics of this? It's not just about RVUs. It has to be about something more. So.
Well, I mean, there have been many studies that have come out that show that patients that have female physicians do overall better and have a small mortality. I mean, recently we talked about that, Palma, remember? So it's like quality. I mean, I'm not saying that men don't give quality care, but yeah, that extra time that you spend, it makes a difference in terms of their outcomes.
So I think it's really important to understand, go back to the topic of negotiation. You're a young physician, let's say a female physician. Let's say you're a mom, okay? Mm-hmm. Let's say, like me, you have 4 kids. You're starting a new job. What is important for you? And sometimes it's okay to say, okay, well, I understand that I'm paid by RVUs. I understand that I get paid by productivity, but I am not going to run after the money. Yes, I need to be paid fairly. Yes, I need to make sure that my base salary is fair. Yes, I need to make sure that I understand my bonus structure. However, I give priority to my family, to my kids. I want to be in their swimming competitions. And so I know I'm not, maybe I'm going to work only 80% of the time and not 100% of the time. So, these questions are really important when you negotiate, because perhaps there's not even an opportunity for you to work 80% of the time. And perhaps it's important for you. And some things in life are priceless. Mm-hmm. So you make sure that when you have this first interaction of whoever you're going to work with, you understand, what is reasonable, what is not reasonable, what is acceptable and what's not acceptable. And some things in your contract can be priceless for you.
Right. And that gets back into why it's always important to understand and know your goals when you go into negotiating that contract. Because just as you've identified, each person is going to have a different goal. It may be raising a family. Or it may be how much money can I make. Each of those goals directs a different type of contract negotiation. And one of the things that's always important when you're reviewing that contract is to make sure that as you discuss those items that are goals, make sure they get included in the agreement. Because one thing that I have to tell clients routinely is if it's not in the agreement, you're not getting it. Mm-hmm. And so that's why it's important to look at the agreement as a whole and understand what your in-game results are that you want to accomplish.
So speaking of your initial contract negotiation, do you think in your, in terms of Trey, negotiating, can you overcome that that earning potential over time? Like say, your first job, you're sort of new at this, you don't know what to negotiate, or in your instance, that was your goal, was to be here, right? So they didn't pay you well, but you were like, this gets me in the door. So can you overcome that earning potential? How do you do that, right? Because I know personally for me, if I started out at a certain number, and as the years went by, it would increase, but it was all counted on, it was all sort of based with that foundation of that number.
So what that initial salary was.
Yeah, that
exactly.
Initial salary, right. So if you start higher, then you're moving, maybe not at a faster pace, but you just started higher, right?
So I would just
if you go up 10% a year, if you start 10% at 100,000 versus 10% at 200,000, that's a significant increase.
Yes.
And so again, that's one of the things that we do successfully utilize. The various benchmarks that are out there, MGMA, mm-hmm. And the others, because getting that initial salary is something that's critical for the long-term effect. Now, yes, as you become more senior, you have more experience, you do have those items to fall back on in order to help increase the salary to get a bigger bump, if you will. But that initial salary is critical, and that's why it's important on the front end to make sure that you understand what the comps are, what the benchmarks are, so that you're at least starting out in the same ballpark as everyone else.
So I would respectfully give a different angle or personal perspective. I started way lower than my peers, way lower. I was an immigrant, I was, female in a male field, and, started very low. And then here I am today. You can compare me to my peers. Mm-hmm. So I would just say, in academic medicine, you have opportunities to change jobs, to advance. Palma was talking about becoming a division chief or a chair. You can move from state to state. There are opportunities in academic medicine that can drastically change your salary, your earning, and your status. So just remember, for all these young people who are watching us, I'm like, oh my gosh, I need to make sure that I get the best. No, in academic medicine, there are opportunities to jump. Mm-hmm.
There are clearly differences between academic medicine and private practice. Absolutely.
Agree.
So can I ask a question? So you're a person looking for a job, right? And it's my third job, right? So you read the advertisement, they say, this is what we want. Well, having done this, a lot of times it doesn't really represent what they actually are really offering. Sometimes it's not accurate. So how do you kind of figure that out? And then how do you identify maybe what that division or that department is looking for? Because what you want or what you can gain depends upon what they value. So part of it, I thought, would be knowing what they value rather than, also what you value, but both. How do you figure that out?
So this is a different question. If I understand you correctly, you're asking about how to get that job, not necessarily how to negotiate your contract in that job. Is that correct? You're asking how...
Well, if you want to make more money and you know that they want an aortic surgeon, and you are a really good aortic surgeon, you could probably negotiate more.
Yes.
But if they're looking for your peripheral vascular surgeon and your focus is that limb salvage, but they have a guy that does that, your ability to negotiate will differ.
Correct. So, it's always good to be the one with the advantage, either the experience advantage, maybe you're coming from, as in our case, when we are, let's say, searching for chairs, they have a lot more negotiation power because usually they have a very successful clinic somewhere else. They are well known in their field, and they are already earning a big salary. So, that jump from that level to a chair level is a high jump. And yes, if you are fighting for a position that is, that you are going to be the only one, basically, or they need you, or you have a skill that no one has. Let's say you are doing surgeries that no one else in that hospital or that area or that healthcare system can do. Maybe you invented a surgery. Obviously, you can negotiate for more if they deem that you are essential. But for the majority of us surgeons, I'm talking about all of us, the majority of us, we're trained to do things that other people were trained to do. And so our kind of cards are not that strong, especially earlier in our career. So if I can give advice, if you really want to be able, you talked about your worth. If you really want to increase your worth, you do something that other people don't do. For me, I'm a clinician and a scientist, and then I went and did another whole 2-year degree in healthcare management. So invested in the things that other people didn't invest in to basically increase my worth. So I can, I can understand clinic, I can understand science, I can understand management. Not many people can understand all of that. And the same thing for surgeons. If you know how to do, one surgery that everybody else can do, you're not that desirable. But if you know how to do many surgeries, and specifically one that is very tough and you have very good quality and very good results, people will pay more to have you be with them.
Okay.
That's exactly what it is, creating a need for yourself, and being able to do those additional things that just the run-of-the-mill is not able to accomplish. That is what creates the need. That's what creates leverage for you to be able to negotiate on your salary, your benefits, and your goals.
Well, so we have lots of questions from the audience, which is great. So I'll start with those. If I only want to work 80%, does this cause prejudice with my employment? So I'm assuming this question is, can I outright say, I just want to work 80%? And how do I do that?
That's a very common question that I get when I'm reviewing contracts, and that's why it's important to carefully review what the duties are and what the commitment is. Most agreements, when we see them initially, the first draft, they say that it is a full-time commitment, but it's very common to negotiate into an agreement a cap or a limit on the amount of time that's going to be worked. So that is something that can be done, but it's something you have to ask for. It's something you have to negotiate. And again, it's one of those things that if you ask for it and you're told that that's what it's going to be, make sure it's in writing in the agreement. I had a lady that I was working with this last week that thought that she was only going to have to work a certain period of time. But the contract, when we got the draft of it, was for full-time employment with a minimum clinical duties of X. And so that was something that we had to go in and redline and review and help negotiate.
So I would just second that and say it's very common nowadays. While it was not common in the past, when I was training, that was not even a question. You're a physician, you're full-time, you're 100% of the time.
Full-time plus.
You're full-time, yeah.
You're there, okay?
Yeah.
You're there 24/7. You're there always. That was the expectation. That's how I grew up. But now it's a different generation with different expectations. And also us as healthcare executives, we're very sensitive to issues of burnout, to the fact that happier physicians deliver better care and higher quality of care, and we care about our patient satisfaction. So we don't want grumpy physicians. We want the physicians to be whole people. So I would just say be honest, and you've heard everything before. And your salary, don't expect to work 50% of the time and get paid 100% of the time. That's not going to happen. But think about what it is that is important to you, and it can be a part-time job, and if it can be done, say it up front. It's very, very common nowadays, and I think it's important to be flexible, and as far as we can provide flexible hours, I'm all for it. I didn't have it, but I want to give it.
Yeah. That's all. So after this, I'll tell Alan I would like every Friday off of work.
Yeah, so that's another thing. This comment is important.
Yeah.
Don't expect to say, okay, I'm going to only work, from Monday, and then Wednesday I can't, but then, Thursday I have soccer. You cannot dictate that amount of detail. And then somebody said, will it be prejudice? Yes, if somebody comes like that and says, okay, here's my schedule,
right,
and this is actually my yearly schedule, and this is how I want to work, and that kind of, okay, I don't want to deal with that person. But if you can say, well, I want to work 80% of the time, and then yes, I'm willing to work, Fridays and maybe Saturdays and cover for this and cover for that, but as long as I'm protected 20% of my time, I'll be happy. That's flexible. You need to be flexible in both ways. If your employer is flexible, you also need to be flexible.
Yeah.
The more rigid you are in the negotiation, I have to say, moved from places to places and negotiated many times, and also hired many people and negotiated with faculty members many times. The negotiation is a beginning of a relationship. People need to understand that. The negotiation is a beginning. If you want to, let's say, come to us, to Houston Methodist, and you start giving the impression that you are very, very picky and very, very rigid, and you're going to be upset about then people may say, okay, no, thank you, and go. So you have to have that flexibility and see the whole picture. So, it's a beginning of a relationship.
That's a
very important point, that it is a relationship, and it's going to be a long-term relationship. And so we've always heard you want to get started on the right foot. And one of the quickest ways that I've seen to get started on the wrong foot is when people try to get in and nitpick things that really don't matter. Again, I keep going back to define what your goals are, define what the major things that you need are, and let's make sure those get negotiated into the agreement. And just like you were saying, it is a give and take. And if both sides are willing to work together, you can work out something that's a win-win for everybody.
That's great advice. Wow, the questions keep coming, so that means it's a great show. This question, I'm assuming it seems pitiful. In order to make large salary increases, one has to be prepared to move. Should folks interview to see what is comparable around them?
What compensation is?
What compensation is out there? So I guess, should you interview at a bunch of different places before having to think about moving?
So I would just say, in our profession in medicine, there is always sacrifice. And all of you who are watching, if you are physicians, and especially if you are surgeons, you have experienced sacrifice in your life. I don't have to explain that. We all know that we sacrificed things when we were in medical school. We sacrificed things when we were in residency, in our fellowship. In order to get something, you sacrifice something. This is part of our profession. So, the question of moving, somebody said it seems pity. You can see it as a pity. You can see it as a great opportunity to move and see other places. But if you're really, born and raised and you feel comfortable only in one place, and it's going to be very difficult for you to move for family reasons or other reasons, then I would not encourage you to go and see what's somewhere else, because I have friends, and even at my level, leaders, that keep interviewing, but then, even reaching and even getting an offer to be chairs, and then rejecting because it's a new city or it's a new state, and I don't know if so figure this, in advance. If you're an adventurous like me, you like moving around, you're kind of a brave enough, and your family is open to that, and you are, all my kids are grown up, they don't, they don't necessarily need to move with me. They are not in school or in high school. That's the worst time to move for a mom.
Okay.
So that's not.
Palma.
Yes, Palma. Yeah. So if you don't, if you know that this is not the right time for you, if you know that this is not going to work, I think the worst thing you can do is go and interview and get that job and say no. Because that's going to, the people on the other side, they are human beings. You're going to break their hearts. They are spending time, and it's just not good. So yes, go and interview if you really are willing to move and you really want a good job. But if you know that this is, your safe environment that you enjoy, then look around your own environment, and that's fine as well.
Well,
I agree with that, because one of the issues that you also have, if you go out and you go through that interview and then you get the offer and you decline the offer, well, that reputation is going to start to follow you. And so it's very important, again, if you're going to go through that process, that going into it, that's something that if the offer's there, that you would actually accept it and you would follow through with it.
Absolutely. And I would just ask your spouse, if you have a significant other, ask them in advance. Don't do something that in the end you're going to get an offer letter and say, well, my significant other does not want to move, because that's heartbreaking, and also kind of reflects badly on you that you didn't take the time to ask if they want to move with you.
Right, lose some trust in your relationship. Palma, did you have a question?
Yeah, I had a question. So I brought this up earlier. So I think that it can be really an enigma how this whole thing really works. You graduate, you look for jobs, you show up, you meet 6 different people, you hope it all goes well, you go back for a second interview, and then you get like an offer letter. So, what is the relationship between the physician organization that you represent and the hospital and the academic center itself? I mean, how are they all related? How do they interconnect, and how do you navigate that?
I think it's an excellent question. Who are you working for? Who employs you? I mentioned to you before I signed all the employment letters, so are you working for me? Did you negotiate with me? No, you did not. You probably negotiated with your chair, and your chair is part of the physician organization, and then he reports up the chain. So the relationship between hospitals, sometimes medical schools, physician organizations can be a little bit tough to understand. But I would say this, to keep it simple, you are negotiating with the person that is hiring you. Whoever invites you to interview, usually in our profession, is the chair. And even though the chair, like in this organization, they are not, and in most organizations, they are not free to do whatever they want to do, right? We have templates of employment, we have standards, but they are the best person to form that relationship with that we talked about, and then they are the best person to go fight for you. And I can't tell you how many chairs, and I was a chair, how many chairs fight for their people when they think it's important to hire somebody and you need to make some kind of concession. So, these relationships that you talked about can be very difficult to understand, and I'm happy to explain, at Houston Methodist how it works. But the reality is that it works a little bit different in every academic healthcare system, especially if you have a medical school involved. But the person you need to communicate with and be frank with and start a relationship with is your chair.
Absolutely on that. And the other thing is, when you get into those discussions, make sure you understand what the person you're communicating with, your chair, make sure you understand what their goals are and what their needs are, so you can determine whether or not it's actually going to be a proper fit, to make sure that their goals and their desires align with your goals and your desires.
We have a lot of, wow, we only have 20 more minutes, but so Mr. Hendershot, this is a comment for you. So going back to, if you were going to interview in one city, so how do you handle restrictive covenants? Can you comment on that?
There's a lot of comments on that, and you said we only had 20 minutes left.
Yeah, and we have like 5 other questions.
Restrictive covenants are probably the second largest area that we spend either negotiating or litigating. And so it's very important in Texas, for a restrictive covenant to be enforceable, it has to be reasonable in scope, reasonable in geographic area, and reasonable in time, as well as it has to provide for a buyout. And so those are some of the things that you need to be very careful about and look into with respect to what's in it as far as the geographic area. Is that geographic area, if you're planning on just staying in Houston, does the restrictive covenant contain a 50-mile radius? Does it contain a 5-mile radius? And so that's one thing that we need to look into. And then also a very critical component is whether or not the restrictive covenant will continue to apply, or if it will be void if the employer terminates without cause, or if you have to terminate for cause. And kind of the statement that I tell everybody on that is, if you didn't do anything wrong, why should you be forced to pick up and move out of town, and why should the restrictive covenant apply? And so those are going to be some critical components. But if your goal is to stay for your entire career in the greater Houston area, the greater New York area, wherever it may be, look into that restrictive covenant and what is the restricted area on it, and make sure that it is also restricted solely to the facility that you provide your primary services, the majority of your patient care activities, because you don't want it to contain language that says at all facilities where the employer provides services, because that can have an exponential negative impact of, again, forcing you to leave town if that employment terminates.
So is it more common that if you were terminated without cause, that the restrictive covenant would not apply, or it just depends on the contract?
It depends on the contract. Methodist has a very good contract in that respect because theirs does not apply if the employer terminates without cause. So I will give them kudos for that.
Yeah. And is that something, if that were in, not for us, but could you negotiate that? Is that something?
That's something we routinely ask for.
Okay.
And it used to be something that employers resisted putting that language in there, but we're seeing now, especially with the hospital-based systems, that language is routinely included in the agreements.
And what about buyout? Does it ever say how much it would cost, or is that something at the?
Yes. In fact, for a physician non-compete to be enforceable, it must contain language for a reasonable buyout. Many times you try to negotiate that on the front end, and we see, again, the benchmarks for that. But as a fallback, you can always have that buyout provision to where an independent third-party arbitrator determines a reasonable buyout. But it's much more cost-effective, saves a lot of headaches, saves arbitration, to negotiate that number on the front end.
That's very good advice. Dr. Shaw, do you have any advice on that?
I would say just agree that this is negotiable. There are things that are non-negotiable, but this one is, and it depends upon the physician, and it depends upon the practice, and it depends upon the specialty. But I absolutely agree that we negotiate this.
That you know, a lot of the graduating residents, they'll come to me and they'll show me the contract, and that's kind of one of the things that is poorly understood, I would say, and sort of that's really helped out a lot, I think, for the audience. Does an MBA increase value if you are 100% clinical?
I guess this is a question for me.
Yes.
So I would say this, in any degree, why did you go and have a medical degree? Why did you go into your residency? Why did you go and have the certificate for whatever? Why did you go and do this Photoshop class? Oh, everything that you study adds a value. Do they pay you if you have, letters after your name? Probably not. If you're 100% clinical and that's your role, and we hire you as a clinician, you're going to be paid as a clinician no matter how many other degrees you have. So does it increase your value? I personally believe it increases your value, but it doesn't necessarily increase your pay. And especially if you decide to take your MBA and say, okay, I'm a vascular surgeon, but I'm going to be, half-time administration, that actually may decrease your pay.
Okay, good to know.
It all gets back to the need. What is the need of the employer?
Very true. Palma, you're about to get your MBA.
No, I finished my MBA.
Oh, you finished. Okay.
I did it in 16 months during COVID.
That's not fun at all.
It was good. When everybody else was sitting around wishing they were operating, I was doing MBA homework. It was perfect. And I think the MBA for me was incredible because I felt that the MBA learning, I use it throughout my practice. I use it in my relationships. I use it to build a limb preservation program. I've used it to enhance my clinical practice. So, it didn't get me more money, so that's true. But I think it made me better in what I like to do. So I think if you like to do those things, it's worthwhile, and it may increase your value. But you have to be happy what you're doing. You shouldn't get it just because you think you're going to get $50,000 more a year.
And if somebody is watching us from Houston Methodist, I would just give a plug to our Physician Leadership Development Program with RICE. So you can get that, paid by Houston Methodist Physician Organization, and get that exactly the knowledge that you're talking about that you can use every day. And that has value. You don't have to pay for it, and it's actually part of your work. So we are just starting our first cohort in January, but it's going to be every year. So if you're watching, please apply.
Trey, were you about to say something?
Well, I agree that having the MBA, again, that goes back to the value and what are your long-term goals. And so you may not necessarily see a pay raise right now because of it, but as you look to the long-term goals for your career and what you want to accomplish and what makes you happy, it is something to be considered that will add value to your career.
That's great advice. And I did want to touch, but this is actually a good question from the audience because I did some research on this. At the end of the day, are female surgeons not negotiating their worth? So there have been a lot of articles about there that we as females, when we negotiate, we're too nice. We're afraid to ask for something, that the answer be no, or that if we come off as, oh well, I deserve that, that raise, I deserve this promotion, that it's unfounded or that we are pompous. And so how do we kind of get over that? And actually there was one article I read where, a woman was afraid to fight for what she wanted because she was afraid to look like a mean, and that's actually sometimes true, that your employer can be like, oh, well, God, she's so aggressive, right? Like your name just labeled aggressive or sort of, not easy to work with. So how do we, Trey, what has been your experience? You've seen this gender gap.
Absolutely. And you've hit on a very good point there. And it gets kind of back to one of the things I was saying earlier. Let's focus on what your goals are and what the needs of the employer are. And let's get those major goals accomplished, but let's not nitpick the little stuff that really doesn't matter. Because that's where I see most of the, when the negotiations break down, that's usually where it comes from, is nitpicking the little stuff. Everybody understands the major issues like the non-compete and the compensation and the calculation of the bonus. Everybody understands that. And so we can usually work through those issues. And so keep an eye on what your true goals are. And I do not hesitate to tell clients when we're going through a physician employment agreement review and they start asking for things, I will point blank tell them, don't do that, because you're going to kill the negotiations and you're going to end up killing this deal. And so keeping it focused on what the true goals are and what the major objectives are is critical.
However,
and employers understand that. That's one thing that I've seen is if you're asking for legitimate items within the agreement, an employer is going to understand that. Now, they may tell you no, but they'll have a legitimate reason for it. And that's where it has to be that good communication.
And I would say, and, very, very true, agree. And it's very true that women negotiate less for themselves. Mm-hmm. I see it all the time. I negotiate with both men and women throughout my career, and I see absolutely the gender difference, and also read about it in many research papers. So, but what women are good at, I think, is negotiating for other people. Let's say your husband is going to go to a different job. You're going to say, oh, you better ask for this and this and this and this. You're kind of pumping it up. And the same thing, for your kids. Okay, you go and this, and you tell your teacher that this. We're very, very good at that, kind of the fairness for other people, but then shyness about saying, well, I need this for me. So, I actually saw comfort in that when I became a leader, because then I could negotiate less about myself and more about other people. So I started, when I negotiated for my role as chair of ophthalmology at UMass, I negotiated with the dean for things for my faculty. So that was more comfortable for me, and less about me, more about resources for other people to be successful.
That's a very interesting, but that is so true. We're not afraid to be, like my husband is going through, some medical stuff, but I'm his patient advocate, and I'm not afraid at all to be aggressive, right? Well, I want this. Well, why is that? And then it's so different when you're fighting for yourself. You're like, oh, well, I don't want to be a bother. Oh, it's such a big hassle to go through this, and ultimately they're going to say no. I'm just not even going to do it.
Yep. No, I think it's still in us. It's still the way that we are raised all over the world. And it's not bad. It is what it is. You just need to know, what are you negotiating for, and then if you have an expert advice from a lawyer, I think that's always a good thing. I would just say your leverage is higher the more experienced you are, the bigger the job you're running for, and then also where you're really needed. That's where your leverage is big. Where you're young and you're just starting and there are really a lot of people like you, even though you may be brilliant, people don't know it yet. So then you have less of a negotiating span. But if you take, expert advice, you can take lawyer's advice or family advice, and also you practice. This is a really important thing. How to ask. It's really uncomfortable to ask something. So I always, in all my negotiations, when I had to ask for things, because it's not comfortable for me to ask, I used to practice. I used to have family, but then now I have professional friends that we kind of practice what you're gonna ask, how you're gonna ask, how you're gonna say it, and then sometimes they say, well, don't say this, but say that. So find these safe environments where you can, or a professional attorney that can help you practice what to ask and how to ask.
That's great advice.
That's very, very important advice, is knowing how to make the ask. Because if it comes across wrong, well, then you're going to get a no as an answer. So just as you said, that practicing, using other people as a sounding board, that's critical.
How would you advocate finding out that information? So if I'm going to look for a job, how do you figure out what they really want? Like, what are they really looking for, so that you know how to approach it in a positive way so you can find a mutual understanding?
So specifically for women, because you have so many women viewers, there is an organization called ELAM, Executive Leadership in Academic Medicine. And I'm a graduate. There are many graduates around the country. And every time there's a job posting, they post it, for any position, director of this, chair of that, whatever, infectious disease specialist, whatever that is. And then they post all the females ELAM graduates in that institution. So you feel as if you kind of you have somebody from the inside that you can reach out and say, well, how is it? And they may not know all the ins and out, but they can give you kind of an overview to the culture of that organization. You need to do your homework, especially, I moved from Massachusetts to Texas. That was really a frightening move. Yeah. And so I tried to see, okay, well, who do I know from Texas? And, what kind of friends or colleagues I have from my different experiences. And this is another reason to go and get these MBAs, because you have usually colleagues that are from all over the country, so you can ask.
So true, because Palm was like, oh, I have this friend in my class, and we should have all the time.
We had a few shows with experts from it was an executive MBA, so everybody was a physician.
Correct. And so
but they were different specialties. Yeah, it was
same
great.
as mine, every different specialties. And we are, our classmates, we graduated in 2020 before the pandemic. So our classes were in person. And I highly recommend this, participating in something other than your specialties. So now, I have physicians, colleagues from all over the country. Some of them are executives and in different specialties, and it's a very good network to have. So ELAM is one of them. I hope we can send from Houston Methodist some female physicians or even scientists to participate in that. But there are other programs as well.
That's great advice. Okay, we have 5 minutes left. We have a lot of questions we haven't even covered, but I think this is a good wrap up. This is towards Mr. Hendershot. What are the top 5 items that need to be defined in a contract?
Your compensation, if it's calculated any other way than a base salary, that needs to be clear, so there's no ambiguity in that. Clearly, bonus structures need to be defined. Your duties, what's expected of you, needs to be outlined and defined. Further benefits that are going to be paid. A big thing that you need to look to, especially if you're going into private practice, is tail insurance. Who's paying for the tail insurance? And
can you define that for the audience?
Sure. Your malpractice insurance can either be what's called a claims-made policy or an occurrence-based policy. A claims-made policy means that the event has to have occurred during the policy period, and the claim also has to be made during the policy period. And if it's outside of that, you have to buy what's called extended reporting coverage. And the nickname for that is tail insurance. And so if your employment is going to be providing claims-made coverage, you need to make sure that the agreement also provides that the employer will pay for the tail insurance upon termination of the employment for any reason. And so the other things that need to be covered is what about intellectual property, the work for hire doctrine, and then of course that non-compete that we talked about earlier. That is something that always requires focus being directed toward the non-compete.
And then try to negotiate, if at all you can, depending on any stage of your career, try to negotiate investment in your career. So what conferences do I go to? What is the allowances for that? Do I get to go to a career development program? Try to negotiate for something that is going to be an investment in you, and doesn't need to happen in the first year, but at least you know that the institution is going to invest in you.
That's great advice too. Yeah. Palma, any last comments?
No, I just I really enjoyed the conference, and I think you gave us excellent advice. I agree 100%. I'm far better at advocating or raising money for other things, for different societies, than I am for myself. I probably do so much work for free, yet I'm raising money for all these different societies, and it's I guess it's a female thing, so I agree.
Yeah, she'll hunt you down for the society money. She's great at it. Great fundraiser. Well,
I'm a stalker.
Yeah. Well, thank you so much. This has been very informative. The audience seems that they were very happy and very involved. So great episode. And then we'll see you guys back in January.
Thank you.
Good night.
Thank you. It was a pleasure being here.
My pleasure. Thank you.
Okay, good night.
Have a good evening.